Today's guest is living legend Dr. Richard Pitcairn, who is much loved and revered in the homeopathic community for the work he's done over many decades in veterinary homeopathy. So, funny story, I usually schedule my episodes 6 to 8 weeks in advance. So as I'm recording this, it's actually the 16th of March, and I've just finished my fascinating conversation with the amazing Dr. Pitcairn, after which I told him that his episode is scheduled for the 13th of May. And he then told me the 12th of May is actually his 83rd birthday. So seeing as this episode will be going live at 6 a.m. on Australian Western Standard Time on the 13th, it's still actually only the 12th of May in America. So, dear Richard, a very happy and beautiful birthday to you. Thank you so much for everything that you've done for thousands of furry and non-furry patients all over the world for many decades. I'd like to really wish you a wonderful birthday and thank you with all my heart. If you'd like to get a copy of Dr. Pitcairn's book called Dr. Pitcairn's Complete Guide to Natural Health for Dogs and Cats, you can find this on Amazon. If you'd like to score extra bounty points, you can use the link in the show notes and purchase it through my Amazon affiliate link, which means I'll get a tiny kickback as well, which will help me to pay for the editing costs of producing the show. You can also visit www.drpitcairn.com or www.pivh.org. Enjoy the episode.
Welcome to the Homeopathy Hangout, where we discuss all things homeopathy from around the world. And now my mum and your host, Eugenie Kruger.
Hello, homies, and welcome to Homeopathy Hangout. I have such an incredible treat for you today. We have the incredible living legend, Dr. Richard Pitcairn, on the show. I feel like I want like a huge audience clapping right now, so you'll just have to do with me. The crowd goes wild.
Well, now I have to go get a bigger hat, see?
Welcome to the show, Richard.
Okay.
It's so lovely to have you on here. I wonder, can you please, everybody in the homeopathic world are going to know you, but we do have some of the public listeners as well. I've done a survey in the past, and it seems to be about 50% homeopaths, 50% general public that listen to the show. So do you maybe want to tell our listeners a little bit about yourself and your background and how you came to homeopathy? That's probably a 1-hour episode in itself.
Well, I'll try to keep it briefer than that. I went to veterinary school in California and graduated in 1965. And my interest was, of course, wanting to help animals because I liked animals and I'd had animal relationships when I was growing up that I thought were important. So that was my purpose. And after I went into practice for, I think it was a couple of years, maybe in Southern California, and I didn't feel real satisfied with the results I got, and then I made the natural assumption was that I wasn't smart enough. And I got an opportunity, I won't go into details, but I got an opportunity to take a job at Washington State University in the state of Washington, veterinary school, on the faculty. And I could also take courses while I was there. So I did that. I taught epidemiology and public health. And that was really fun for a year. And I got to take a year in training in virology. And I found that really fascinating because I didn't know that much about viruses, even after my veterinary education. And I was learning a lot more than most people really know about viruses. It's just, they're amazing creatures. So I found that fascinating. As the year was coming to an end, I approached the virology professor and asked him if the next year there was going to be anything else I could do, because I really enjoyed studying it. He said, well, let me get back to you, which I thought was kind of odd. He didn't know. So I go back to my office in the other building. Next morning, the head of the microbiology department comes down and says, you're in. And I said, in what? They were offering me to enter a PhD program with a salary. So I said, okay. So I did that for 6 years, and I studied viruses. I did tissue culture work for years in the lab. I taught virology. I helped teach it. I focused primarily on studying the immune system. All very, very interesting work. But when I got out, I decided to go back into practice and try to use it. And I realized I'd learned a lot about the immune system, but not really necessarily how to bring about health again, you see. More how it could go wrong. So anyway, I went back into practice and I tried to use it and still didn't have such great results. And I guess discouraged I actually did a Hahnemann, if you remember his path, where he drops out of practice for after a few years. That's what I did. I just got so discouraged. For a year, I taught physics in a high school, and but I had to go back into practice because I wasn't making enough money for my needs. So I did. I ended up, after another year or so of practice, I took a job at you know what an SPCA is?
Oh, yeah, we've got them over here as well.
Okay. So I took a job at a clinic in California, and I was there for 7 years. And I did that because I could just mostly do surgery. I didn't have to really practice medicine too much. But meanwhile, having in my mind given up practice, I still kept looking for other ways to heal. I couldn't keep my mind off of it. So I looked at that time, some of the popular things are polarity therapy and color therapy and, I don't know, different Chinese medicine, but nothing really particularly interested me. And then I came across this book by Dorothy Shepard, Homeopathy for Dogs. And I thought, wow, that is interesting. I kind of like this one. So I started studying it. But it was back at a time when there's no internet, and I didn't know anything about Hahnemann. So I started studying it. When I would come across a book in a bookstore that had to do with homeopathy, I'd get it and I'd try to use it. I won't go into all the detail. I've probably taken too long anyway. But for some years, the first few years there, I tried a lot of different methods because I didn't know anything. There was no training for me. And so I didn't know. I just go to a homeopath and ask them how they did it. And, so I ended up, I won't go into all the different paths I took, but I took a different approaches that I now realize weren't really what Hahnemann taught. And as an example, one homeopath basically taught me or pointed me in the direction of radionics, if you know what that is. So I did that about 3 years, serious work, going to meetings. And then I kind of lost my enthusiasm. I didn't see the results or accuracy I thought I should get. So anyway, it all led to finally, I went to a meeting in 1978. I went to a meeting in San Francisco, a homeopathy meeting. It was with George Vithoulkas was the main presenter. And
George must be about the same age. Oh, no, George is is 90 now. I think what are you, 82? 80?
Yeah, I'll be 83 this May.
Oh, wow. It's incredible. Wow, what inspiration. And I think George is 91 or so now.
It could be. I don't even know his age.
Incredible.
Yeah.
Wow.
So anyway, at that meeting, at the break, they announced that they were starting a training program for health practitioners and homeopathy. And I was so excited. I had to join it. So I went up to sign up. And unfortunately, sadly, the person that was doing the sign up said, veterinarians can't do this work on animals. Oh, I was so disappointed. I went back just really sad, So, okay, so I leave the meeting and I just couldn't stop studying it anyway, you see, even though I wasn't going to use it. Isn't that odd?
It's so cool. It's just, just keep going and take your time because I've got no time constraints at all. So
Okay.
I've got the whole day free. So take your time because these stories are just so precious and it's beautiful seeing your journey.
Yeah, so I would study it whenever I had free time. I studied at lunch there. When I'd have my lunch, I had Borke's Materia Medica. I'd take it out with me and I'd eat lunch up on the hill there. And this is in Southern California or in Middle California. So it was pretty nice weather. Anyway, so I was learning the remedies and how they were used according to the study, but I wasn't, practicing. So how I got into it was that had to do with issues that came up with the staff of the clinic. And they developed some serious problems. And my sympathy was such I couldn't resist offering them a remedy. I was hesitant to do, because I didn't know much, I felt. And I'll give you one example. One of the first ones was a woman there that operated the front desk where the people came in with their animals. She was driving to work in a little Volkswagen, and she got hit in the rear, and her head hit the windshield and broke the windshield. So it's pretty hard. So she then went to emergency care, was treated, came back to work. And what was happening then at work was that she would be standing there talking to somebody and go unconscious. And she wouldn't sink. She'd fall like a log, whap, and hit the floor. Well, that was happening repeatedly. And so I heard about it. I was in one of the little lab room we had, and she came in for something, and I said, I heard what's happening with you, and a little bit of, and oddly enough, I don't know if it's accurate, but oddly enough, she said the doctor said it had nothing to do with her head injury. They had scheduled her for surgery in 2 weeks to remove the top of her skull to look for a tumor. So I said, would you like to try a remedy?
Nothing to lose, right?
Well, I just couldn't hold back. So I asked her a little bit more about the head injury, and I gave her a dose of Nature Muriaticum, 30C. And after that, she was entirely normal. No surgery, went on, normal life. So that's an example. And I had some other ones like that, serious injuries, or one was the director of the clinic had a severe bladder problem that I was able to solve with pulsatilla. And so, those things, that started me thinking, well, maybe that's, it might be worth trying in an animal. So I did try it in some of the clinic animals when they were injured. Like one of them, for example, was a dog that had been tied in the back of a pickup and had jumped out while the guy was driving and dragged for a mile down the freeway, lost half of its skin. They brought it in, and he's like, what in the world are you going to do with this, So I thought, why not just try? I had ordered some homeopathic ointment for some reason. I think it was calendula and hypericum, maybe some combination. But let's try that. So I smeared that on the dog, and the dog did fine. Very little pain, no infection, never gave antibiotics. Skin grew back in a week or two. I was very impressed. So then I started treating some other animals occasionally as they came in with different injuries. One was a gunshot, and I treated that successfully with a remedy, shot through the shoulder. And it was pretty severe, because was a lot of nerves there in the shoulder through the area that's the joint there where the armpit is. There's a lot of nerves. It went right through there, the bullet. And the dog couldn't use his leg. Well, I gave one dose of, I think it was hypericum, and the next day it walked normally. And the funny thing about it, which was a prelude to what I was going to be seeing in practice, was when the guys brought their dog in, and I went in and got a remedy and gave it a little pill in the mouth. Then they said, when are you going to treat it? I said, okay. So I went back and got a syringe full of saline and injected the dog with saline. And then they were happy. So those are just examples. There were quite a few other interesting ones that I don't want to take time to go into, but it started me thinking about that really maybe it did work in animals in spite of what I was told. So I tentatively opened up house call practice in my free time and started doing house calls using homeopathy. And I saw some results there. Again, interesting cases that one was a cervical disc herniation, in the neck, and the dog was in great deal of pain. And when I went to the house, it was constantly walking around the perimeter of the room and stopping to drink water. So I gave it arsenicum, and it was it recovered. One dose. So I became very impressed that maybe it could work, to the point that in 1985, I moved to Eugene, Oregon, and opened a homeopathic clinic. And so all I did was homeopathy and nutrition therapy. And I did that for, not about 18 years. And I was really busy and successful and had wonderful cases.
All for animals or for humans as well?
Just animals. I only had a veterinary license. You can't treat humans.
No,
don't tell anybody.
Some humans are worse than act like animals.
Don't tell anybody I treated the staff.
Okay. I was going to ask you as well, had you discovered the organon or chronic diseases by this Hahnemann's books by this stage? And where did you get your remedies then? That must have been, was it hard to get hold of?
Yes, it was more difficult. I don't remember the year that I came across and discovered Hahnemann. I'd never heard of him before, but I came across him. It was probably while I was at the SPCA clinic after a few years down the line there. I don't remember when, maybe 2 or 3 years.
You were kind of developing your own style of homeopathy and figuring it all out until you found the organon and Hahnemann, and then you're like, oh, this is how you do it.
Yeah, well, I was just trying to use the remedies as best I could. In other words, match the remedy to the symptoms. I understood that part of it. But then I discovered Hahnemann and got his book, got the organon. And oh my gosh, once I read that, I said, that's really a science. Now I understand it. And that really improved my practice. That was profound. And so that was why I probably started to practice in Oregon, because I felt now more confident that I understood it, how to use it. As far as getting remedies, I don't remember where I got them anymore. It's so many years ago. But there was a pharmacy I could order from. And also, during the 1980s, I got interested in LM potencies.
Oh.
And so I contacted a practitioner that used them, and he sent me a number of the remedies, maybe half a dozen or so in LM1. And I started making my own LMs from that point on, using the method that Hahnemann gave. So I'd make an LM2, LM3, and I had to get absolute alcohol and the little pellets, the right size pellets and everything. So yeah, I was really into it. So the practice went really well until the point I retired. And then along the way, I was invited to speak at a couple of meetings, and I did. And then they wanted me to start a course. And so I was never planning that. So in 92, I started a training program for veterinarians. It was a year-long program, and it was successful, and it's been going ever since.
And was your college the first veterinary homeopathic college in the world, or was there any before that?
The training program?
Yeah.
I don't know if it's the only one. I'm not aware of any other in the world. Certainly none other in the U.S. I'm sure there wasn't any program in the U.S. I don't know all the other countries, but I never heard of one.
Yeah. Well, my really good friend, Micah Turnbull, who's just down the road from me, she's been studying with you, and it's been her dream for a very long time. And she is absolutely loving it. And she did tell me what an amazing storyteller you are. So I really, really appreciate your beautiful stories. And you taking us on this journey with you. And I'm looking forward to hearing lots more, because I have about a bajillion questions to ask you.
Oh, wow. Okay.
But what you were saying about, like, once you understood the organon and that really improved your practice, maybe for the homeopaths out there these days, I mean, you've got decades of experience now. How has your understanding of the organon changed over the years, and what sort of message can you give to homeopaths these days that they can really take from the organon and take from your experience?
Yes. The one I like the most, that I've studied the most, is the 6th edition, edited by Wenda O'Reilly, if you're familiar with that. Very well done translation. She used a German scholar that knew the language of that time, and so it was very, very good. And she included the introduction and her version of it, which isn't included in most of the translations, Hahnemann's introduction, which is really profound. What I would say to encapsulate this would be to say that understanding Hahnemann and seeing the effects of using his principles tells me that before that time, I did not truly understand reality. I had been trained to think that the world was a material place, that what disease was and what health was. And Hahnemann completely turns it on its head. He tells us in the Organon that we're spiritual beings. I think it's aphorism 9, if I remember right, but I may have the wrong number, that we are spiritual beings and we've created a body to use as an instrument. Have you seen that one? That's profound, isn't it?
I quickly want to insert a little bit here for our listeners. If you actually go on any podcasting platform and you type in 1M presents the Organon, it's actually Kelly Callahan who reads out the entire Organon with Wenda Brewster O'Reilly's permission. So if you say homeopaths should read the Organon twice a year or something along those lines, but you can actually listen to it so just while you're driving. And Kelly has read the whole Organon out.
Well, give me the link again.
Yeah, sure. It's just on any podcasting platform, and you just type in, so it's Spotify, Google Podcasts, Apple Podcasts, anything like that, and you just type in 1M, a homeopath podcast, presents the Organon, and she just reads it all out.
1M homeopath.
I'll send the link to you afterwards.
Yeah, that's interesting.
Yeah.
So the other I'll mention briefly, the other really important part of my learning, a few years after I learned the Organon, was the chronic diseases and understanding the miasms. Hahnemann tells us the idea of diagnosis is incorrect. Diseases are individual. We're not to operate from the idea that there's an external disease. They're not external diseases. The disease is not physical. It's a disturbance on the non-physical level of the life force, right? Is this the kind of thing you're asking about?
Absolutely. Yes. And that's the stuff really that we need for deeper healing, right? Is that understanding. And I can imagine coming from the virology PhD, your brain would have been working that way. And like you were saying, you were learning about disease, not really how to heal. And so finding Hahnemann, I can imagine this would have been quite profound for you. But keep going.
Well, it was a gradual learning. I had all that training. It was hard to give up.
Mm.
So the same with coming to the point of seeing what vaccines could do. I was very reluctant to let go of what I'd learned about vaccination, but I did gradually. I saw it. I had to admit the truth of it. So Hahnemann's view is really quite different. And like Kent says, the physical disease we see is what Kent called the ultimates, the outcome of disease, the shadow of it, if you will, or secondary manifestation. The disease itself exists on a non-physical level, on the level of a mistuned life force. And that's what we have to address. That's what we have to see. And then when you come to the chronic diseases and you learn about the miasms, then it's, again, also different in that they are living entities like we are, what he called a vaccine. And they, like Sora, is something that's existed in us, uncured for centuries, many centuries. And Hahnemann predicted it would be increasing, which it has done since his time. There's more and more Soric, and especially compared to Hahnemann's time when he wrote about the three miasms, the other two being psychosis and syphilis. The other two miasms were not as prevalent by far, because he doesn't talk a whole lot about them. He talks mostly about Sora. In today's world, psychosis is very prominent because of vaccination. So we deal in our veterinary practice, we have to deal so often with vaccinosis. It's just amazing how big a factor that is.
Very interesting, because I always feel I can pretty much give thuya to every single person that comes into my clinic, and all of them will probably have a healing response of some sort to it.
Of some degree, yeah. Yeah, it's really, really sad that that's being done. That's the whole topic in itself, is how vaccines have been exaggerated. They really don't do what they say they're going to do. And also, coming from Hahnemann's understanding of disease, that disease is a communication of a non-physical, you might say, influence or energetic configuration on the level of consciousness. It's not on the level of the physical body. And so when you have a disease, a virus, say, that's been developed into a vaccine and it's injected into the animal, what you're doing is communicating the virus disease, that the virus has been modified so it doesn't cause so many physical symptoms, but you're communicating the whole energetic influence of the disease. You're actually giving the disease to everybody that's vaccinated. Does that make sense? That's really important to understand. It answers there's so much controversy now about the COVID vaccine, all these different vaccines, whether they're good vaccines or bad vaccines, and on and on. But once you understand that whenever you inject that, you're communicating the energetic influence of the disease, period. And then you understand what the problem is. You see, homeopathy is simple.
Can you just say a little bit more about what you mean? So when you are vaccinating, you're actually giving the disease to the person as well.
Yeah, a disease like a virus disease or a bacterial disease, for example, in its natural form, outside of homeopathy, they're living beings, just like we are. And they have the ability to modify themselves, and we would say evolve or change or adapt, right? Like, for example, with epidemics, it's known that as epidemics recur over years, that they become more and more mild because the organism adapts itself in such a way as not to cause such severe symptoms. It's to its advantage to do that. So what I'm saying is that the fact that the expression of the virus or the expression of the bacteria in what we would see as physical sensory observations can be variable depending on the state of the virus in terms of its intent, how to manifest itself. But the energy that's behind it, the life force that's behind it, is the same. The life force hasn't changed, right?
That's really interesting. So even
if you take
inactivated virus, because you know how when some of them are live and some are inactivated. So even if it's an inactivated live virus, the energy that's behind that, you say?
I'm not really sure that probably, but I know that modified live, they're still living viruses. And they're modified so that they've adapted to another animal. Say, for example, we're going to make the usual way that a vaccine would be made. and would say take it from a person and work with it to make it such that it would grow in a pig or a chimpanzee. And once you've accomplished that as a scientist, then you get the virus to grow there, which adapts into the animal it's growing in. And when you put it back into the person, it doesn't right away cause the same symptoms because it's adapted to the different species, right? So that's what the advantage of modified live. It doesn't cause the same symptoms as before, but it's still the same virus.
Interesting.
And the same energetic pattern, same life force. You see?
Mm.
Now, whether the killed has that, I don't really know that I can say with certainty, but it's likely.
And
Yeah.
that doesn't even go into the antibiotics and the preservatives and the heavy metals and everything else that's added to that as well, which in animals, it's almost worse because the dose isn't adjusted to the size of an animal. So you give the same vaccine to a Great Dane as you would to a Chihuahua, which just is bananas.
Yeah, yeah.
Well, that kind of leads me almost on to the next question I want to ask you was also what sort of changes you have seen in animals over your decades of practice? Because this is the beautiful thing. If you've been practicing as long as you have hindsight, right? You can kind of look back and see, okay, how has things changed over the past few decades? And as more vaccines more regularly are being administered to animals, have you noticed an increase in chronic disease? I mean, it's kind of like a rhetorical question, but what sort of things have you seen over the past few decades?
Yes, much, much more development and incidence of miasmatic conditions, psoric and psychosis especially, so that the majority of, as a veterinarian practicing homeopathy, by far the majority of your cases will be chronic disease. And you have to understand the miasms. You'll have acute, of course, injuries and such like. But as a couple of examples, in dogs, a very common problem is what they call hip dysplasia, right? You'll find a description of the hip condition under Thuya. It's right there.
Wow.
Yeah.
That just makes me think, because hip dysplasia it seems like every second child in the clinic that I'm seeing has got hip dysplasia. And, they're vaccinating the mums during pregnancy these days. I never even thought
Unbelievable.
It could be connected.
Well, of course. And, if I may comment on that, it's because of my training in immunology. Not that I'm an expert necessarily, but I did train for a number of years studying immunology. And one of the things I learned was that it's the same in animals as in people, but in people, that when the child is born, its immune system is not yet matured and doesn't have the ability to respond to vaccines or to antigens. It survives, the infant survives infectious disease by passive immunity, it's called, which is that it got antibodies from the blood of the mother. While it was in the uterus, the mother's antibodies from prior diseases the mother had were communicated to the child. So for several months after the child is born, those antibodies there of passive immunity protect the child if it's exposed to the infection. Does that make sense?
Yeah.
Okay. So why would if anybody understands immunology, why would you vaccinate a child when it's born? It can't respond to the vaccine. And what you do is use up the antibodies the mother gave. It made the child more susceptible. So it doesn't make any sense. I don't know why they're doing that. I mean, I don't know why immunologists don't speak up. It's not my opinion. It's just a part of immunology to know the immune system's not developed yet in a child.
I have heard that it's not actually until about 9 or 10 months that they can seroconvert. So it's kind of pointless vaccinating the child until 10 months. I mean, I think it's pointless anyway. My kids are unvaccinated and they are the healthiest children on the planet. So I don't need anyone to convince me otherwise. I see the proof.
Yeah.
So, yeah.
And not only that, but they actually cause harm because they use up the passive immunity.
That part's interesting. I never actually realized that. So by vaccinating you're then introducing the disease into the body. So it's actually using the immune cells that you create, that you received from your mum in the womb. That piece of the puzzle I never knew. So that's very interesting.
Yeah. The child gets antibodies. It doesn't get the cells necessarily that produce them, but it gets the antibodies circulating in the blood. Well, if you use up say you use up half of them, you don't have the same immunity, do you?
Fascinating. And of course, Mother Nature in her infinite wisdom, knew that we were breastfeeding, so you'd be passing that on. But if you have any vaccine immunity, you can't transfer to the child anyway. So if you have been it's only naturally acquired immunity. But unfortunately, there are just blatant lies being told by the medical profession these days that if you vaccinate a pregnant woman, those antibodies transfer the placental barrier and then your baby is protected through that, which is, sorry, but that's just BS. And I haven't even done, a fraction of the study that you have in immunology, but that's BS, right?
The passive immunity, the antibodies do pass to the child, but
Oh, okay.
but so maybe it works, but how well it works or how efficient, I have no idea.
And at what cost?
I haven't studied that.
At what cost if you had, and at what cost if it does, if you have heavy metals and everything else and everything else added to it?
Well, back to what I said a little bit ago, when the pregnant mother is vaccinated with the disease, you're transmitting the life force of the disease. Mm. What will that do to her development of the embryo? Mm. How will that affect her health? You see, will the child be born with deformities, cleft palate, retarded? Mm. We don't know, right? It's kind of arrogant, isn't it? It's like, oh, this will work. We don't know what the effect will be when we do it. So it's a big topic and it's unfortunate. But to answer your earlier question about what I've seen in animals, I've seen more and more disease due to vaccination and also from environmental influences. And when I graduated in 1965, in the first years I was in practice there, we would do dental treatment, scraping off plaque or dealing with inflamed mouths, right? We would do that fairly often with dogs. Very rarely did we have to do it with cats. They never had any mouth problems. Today's world, you see these very commonly, cats have inflamed gums. They have a red line along the teeth. Some of their teeth fall out. Why is that? Well, you look at what they're fed as a commercial food. Mm. Most of them contain fish, which has mercury in it. So they have mercury poisoning. So you have to treat, when you get that animal in, you have to treat for mercury poisoning. So that's just one chemical. I don't know how it is in Australia, but in the U.S., our government has approved the use of 100,000 chemicals. And less than 4% have ever been tested for health effects, and none of them ever tested in cats or dogs. Mm-hmm. So we don't know what they do. The environmental problem is very profound. So I think a lot of chronic disease is caused by contamination of chemicals in the environment now. And there have been, if you're not familiar with it, there have even been more recent, last few years, tests of dogs and cats to see how many chemicals they have. And they have as much or more than humans, actually have higher levels. Did you know in the U.S. that the average human has over 400 chemicals in their body?
I believe
some of which are carcinogens.
Most probably of which. I've heard that apparently babies are born in the fetal cord blood. They find over 200 chemicals, before.
Over 300.
Babies just, wow. It's like, welcome to the world. Here's this beautiful toxic load to get you started.
Yeah, for some reason, I don't understand it. Maybe you have an opinion. But it doesn't seem like medical practitioners have much interest in this as a factor, the chemicals that they're getting. I mean, if you have a baby and it's been, and say somebody came along and deliberately injected 300 chemicals into your baby, you'd be very upset, wouldn't you? And yet, as you said, babies are born today with over 300 chemicals, some of which are said to interfere with development. Well, could that be a factor then, say, with this current issue they call transgender? The children aren't growing fully and normally? Is that what the problem is? Does anybody look at that?
They don't want to, because there's too much money to be made from all the drugs that they can sell them for the rest of their lives. So
maybe that's it. Maybe that's the motive. I don't really understand it, why there isn't attention given to the chemicals. But I think that the chemicals that the animals, or the dogs and cats especially, well, horses too, and probably other livestock, they're getting all these GMO foods and added preservatives and whatever they use, herbicides. I think these are really big factors in making them sick with chronic conditions. And then on top of that is the vaccines. So I would say that as I said earlier, most of the animals we see in our practice, you can assume they have SORA, because Hahnemann tells us that the presence of SORA is what makes you susceptible to psychosis. So that's why then you're affected by the vaccines, you see? So I see a lot more chronic disease in animals than I ever did when I graduated. Much, much more. And it's going to increase, until we finally wake up and turn it around. That's why it's important to teach homeopathy.
Absolutely. And over here, they spray glyphosate left, right, and center in all the parks. And so you're taking your dog for a beautiful walk in the park, and they only have the sign up while they're spraying. So, the second they leave, they take the sign with them. So you arrive there straight after. There's no warning that it's just been sprayed. Your animal's walking on there. It's licking its paws, it's absorbing all that glyphosate. And I've just always thought it's just so weird that an animal should be allergic to grass. It just evolutionarily, it just does not make sense that animals should be allergic to grass. No. And so we really need to question, why is that? Not just try and suppress it with steroids and things like that. What is going on? Why is your animal allergic to grass?
Yeah, yes, exactly. And then the same thing happens when people spray their yards. Mm. Yeah, these are things that are really important, I think, to understand. And for some reason, they're not given much attention to. But when you're a practitioner, you have to understand it. You have to understand that, it'd be foolish if an animal's being exposed to chemicals regularly, say in the food, like cats being fed food that contains mercury, and then you treat with homeopathy and they improve. Well, it would be very foolish to let them continue eating that food, wouldn't it? That doesn't make any sense. You have to do the whole package. You have to change the diet. Like Hahnemann talks about, the living conditions have to be improved. Otherwise, you'll have chronic disease that's not even miasmatic, he said in the Organon. So anyway, I think that these things are really important for the practitioner to understand, that you have to understand the conditions we're working under. Mm. A lot of the diseases we see now that I saw in my practice, and probably you too, chronic diseases are such that Hahnemann in his time would have said we're incurable. And we're working with them, and we can cure them sometimes.
And Richard, do you ever use much homeopathic immunization in your practice? So
what is that?
Oh, homeopathic immunization. So giving like a noso to prevent a disease. So giving kennel cough to prevent kennel cough.
I did that in my practice I had in Oregon. I would use the nosos for clients that were willing not to vaccinate. Mm. I would use them. Not too many. I didn't do it with rabies. It's too risky legally. But with distemper and parvo, particularly panleukopenia, those were the three I think I used. Mm. And it seemed to work well.
So you were doing homeopathic immunization without knowing it.
Well, I don't know if it's immunization in the sense that it produces antibodies, but what it does is it removes the susceptibility. It satisfies the susceptibility. That's what Hahnemann tells us, that the medicine takes the remedy, matches the susceptibility, and that connection then is such that if the same disease came along after that, a few days later, there's no susceptibility to it. It's already satisfied, right? So
that's amazing. Yeah, the lovely Dr. Isaac Golden has done so much work on that, and I've definitely used homeopathic immunization with my animals as well, and it's been really great. Mm-hmm. I mean, they're just really, really healthy. I wonder, do you want to mention something about diet in animals? I know that is like a huge topic, but maybe like the main culprits that you see for, let's say, cats and dogs, because, that's what most people have. And you've mentioned about the fish for cats, which I didn't even, didn't think about, the mercury. But any other like really bad culprits diet-wise that you think people should be aware of?
Well, the main factor and we're talking about dogs and cats primarily, because I don't know as much about feeding horses and other animals.
We'll do dogs and cats.
Yeah, dogs and cats. The main thing is if they eat meat. Meat is so filled. I don't know if people understand. Let's see if I can explain it without too much length. The chemicals that we were talking about earlier, the thousands and thousands of chemicals that are used, 100,000 in the U.S., many of them, most of them, end up in the environment because they go down the toilets or sinks, or they give off a volatile, like furniture that's treated to be fire retardant. That's volatile. It gives into the air and it's blown around. So, for example, they have found that the bedding and probably clothing and so on that has fire retardants in it, when it gets into the air in the U.S., it blows up primarily to Alaska, and the children in Alaska have the highest amounts in their bodies of fire retardants. So that's just an example of how we have to understand that whole dynamic. So the problem is that the chemicals get into the water and air in the streams. When you learn about how sewage treatment is done by towns and cities. I don't know how it's done where you live, but here in the U.S., they run the sewage into a pond, and it settles. Some of the stuff settles at the bottom, and then the liquid part they run off. They supposedly test. They only test for about 4 or 5 things, not the 100,000, and they run it off into a stream. Then, so it goes back into the water. All right. So the water then goes through and contaminates the environment, the fields and the pastures, and some of it comes down in rain. And then you've got it from the air, as I said, and then some of it's from fertilizer going back to the ponds, sewage ponds. The solid material at the bottom, what they used to be called sewage sludge. You've probably heard the term. Will have the most chemicals in it. It's the most contaminated you can imagine, right? Mm. All right. So some years ago in this country, the FDA decided that, let me back up. The problem was that the towns and cities didn't know what to do with the sludge. It was building up. There was so much of it. Where do you put it? How do you get rid of it, right? So the FDA set up a contest to rename sewage sludge.
Oh.
And the one that won it,
right?
the one that won it, and it was renamed biosolids. And once it was renamed as biosolids, the FDA approved its use in a fertilizer. Oh. So it can be used on food crops.
I've never heard that. That's shocking.
Yes. You can go down and buy a bag of soil and you'll see in there biosolids in some of them. Not all of them, but some of them. So yeah, so you see, what I'm trying to point out here to you is how extensively the environment is contaminated. So then what happens is when it's in the soil and water, say in a pasture, then the plants take it up into their little bodies, right? And then along come the animals that eat the plants. So because they're eating plants repeatedly, it builds up in their bodies to higher levels. So you'll hear people say, well, I don't want to feed plants because they're contaminated with chemicals, but they'll feed meat, which has 100,000 times higher levels of it because their animals are eating the plants day after day after day for months. And that's called food chain or bioaccumulation. You've heard that term maybe? Yeah, so the most contaminated food that you can give to dogs and cats are meats, animal products. So what we've done, can I show you something? Hold on a second.
Yes, of course.
Have you seen this?
So beautiful, yes. That's the 4th edition.
4th edition.
Oh, beautiful.
Primarily,
oh, it's a nice chunky
without...
book. Are those your own little inserts on the side, or does the book come with that?
Oh, those are mine.
Oh, okay.
So, and my wife did the drawings in there.
Amazing. Actually, I'll just say for our listeners that are just listening on the audio that don't have the video to accompany that, it's Dr. Pitcairn's complete guide to natural health for dogs and cats.
Right. And the recipes that we worked out with a lot of research so that they're nutritionally complete are recipes that don't use meat. Most of them.
Interesting. So what would you feed your animals then if it's not? Because to be fair, our neighbor just slaughtered a sheep the other day, so our dogs are feasting at the moment on the organic sheep from next door. But what's just trying to wrap my head around, how would you feed your cat and dog that doesn't involve mainly meat?
Well, first of all, dogs are not carnivores. Biologists classify them as omnivores, which means they can eat plants as well as. And a very interesting study came out. I don't have it right in front of me to tell you the title. A study came out a few years ago. Some scientists did a DNA sequencing of wolves and domestic dogs. And when they did that, they found that domestic dogs have evolved and adapted so they can eat the same food as humans, grains, starch, everything. No problem. They have amylase. They can digest everything we eat.
Amylase is in the saliva, right? That breaks down the carbs in yours. Okay. That's interesting. So, so they can eat the food without any problem. And our experience with it, when a lot of people are willing to change over to the recipes that don't have meat in them, the animals get much healthier, noticeably. That's interesting.
Now, cats are more difficult. Cats are carnivores.
And
now, they can do it too. It's possible, but it's not as easy. And sometimes you have to start out when they're very young. But they do well on it if they adapt to it. They do well on those same kind of recipes. So, the problem is, considering what we're talking about here, all the chemicals they're exposed to in the food, then what a solution is there? The only one I could come up with is feed less of it.
Mm.
If they're taking in chemicals in large quantity, you can't completely eliminate them, not totally, but you could certainly reduce it from down to less than 1% of what they were eating before. Doesn't that make sense to do that?
It's common sense, really. I just never thought about it that way. That's why I love this podcast. Our beautiful guest has always managed to make me think in a different way. I'm just, thinking with cats. I mean, they're so bloody fussy. We've got 2 cats, and like you just they will just not eat. If you don't give them what they want, they just won't eat it. But then also kibble, the dry kibble, I'm guessing that's really bad. I feel really bad because my animals get a mix of raw and then sometimes kibble more if I'm in a rush and I just can't be bothered. Or if the kids are too lazy to go get the meat out of the fridge, then they'll just get some dry kibble, which I know it's really bad. I always say to the kids, it's like feeding our animals McDonald's. We try to keep it to a bare minimum, which, we don't eat anyway, but just to give them an idea of how bad it actually is for the animals. But what would you say about dry kibble for cats and dogs?
It's really not. I understand why people do it, but we don't really recommend it as an ideal. It depends on what people can do. Some people don't have time and willingness to, to search for a different food or make their own recipes. But I can only tell you from my experience, from the veterinary perspective, that if you can take charge yourself and make the food and buy organic ingredients, you'll see a noticeable health improvement. Sometimes enough that you don't have to have any more treatment for what you thought was a problem. They actually recover. Now, going back to cats, if you study our book, we do have some hints about how to make the food more enticing.
Okay.
And sometimes you can modify part way and reduce the amount of meat. It's possible. But it is tricky. It's tricky for cats, yeah. So, that we have a lot of challenges in the way the world is today. Hahnemann didn't have to face. Back in Hahnemann's time, it was all organic food, right? That's all there was. There weren't any synthetic chemicals.
Amazing. Imagine.
Yeah, so that's really a big factor. He didn't have the vaccines to deal with like we do now. Also some of the environmental conditions that we live in now that he didn't have to deal with back then. And there's all the electromagnetic radiations and all this stuff, So it's a challenge. But what I emphasize in terms of understanding what we're talking about is for the practitioner, is you have a better way than of assessing your case. You know what you're dealing with. You know what's possible expectations, right? You see depending on what they're fed, depending on whether they've been treated and suppressed before, how much they've been vaccinated. You factor all that in to decide whether or not, first of all, it's even a curable case. And then how are you going to go about curing it? Like, for example, if it's an animal that has chronic disease that's been treated for some time, maybe a matter of years by the conventional treatment, so it's very suppressed and palliated, and it comes to you, you can't recognize the similar remedy. In a case like that, you have to treat the suppression first. And once you're able to remove the suppression over a period of weeks, maybe, or months, then you begin to see the disease. Well, how many clients are going to be willing for you to work that long with them? See the problem? Yeah.
It's a big mountain. And I think that's where education is so important. And that's why I really love this podcast and the feedback that I've had from people around the world. And why I started the podcast in the first place, because I want people to understand how homeopathy works so that they can be more patient. So if they can understand what true health and healing looks like and the benefits of that, then they are a bit more patient to get back to that kind of basics. So like you were saying, the pharmaceuticals and like just kind of clearing all of that so that we can kind of get back to ground zero and then start our treatment plan. So we're starting in the negative. We're starting on the back foot often when we start treating people because of all this drug suppression. So we're just trying to get them back to ground zero and then we can build up from that and having people understand that is actually what we're doing. Not giving you.
And we have to be able to see the disease to match the remedy to it. And so you have to be willing to bring the disease back, right? How else can you do it? You don't have to bring back the whole thing, and it's really severe, but you have to have some guiding symptoms, something to guide you. If you have a dog with itch, and you look in a rubric, it's got 600 remedies in it. Which one are you going to use, right? You have to be able to bring about symptoms that will guide you to the remedy that will be curative. It does take patience, and it does take understanding.
It's important for people to know that you do see improvements along the way. It's not like you're not going to see any improvements and then after 2 years you'll see improvements. You will see small incremental improvements every single step of the way. So
yes,
it's worth
I
the
agree.
journey.
Yes. It's just that people have to be a client that works with you that way. The client has to understand that to bring about a return of health is not the same as just making symptoms disappear, like drugs do. That's not curing the disease. That's hiding the expression of it. So to cure the disease, you have to eliminate that influence that was there at the beginning. And you have to be able to recognize it. You have to be able to see it well enough to know what remedies to use.
Exactly. So something else, kind of shifting things a little bit, is I would like to ask you just a little bit about surgery for animals, just because it's something that I get asked quite often. I've heard that obviously remedies like hypericum can affect the anesthesia if you use it before an operation. So there's always this discussion about whether we should give any remedies before surgery or not. My personal recommendation is usually just things like maybe Justimum or Califos in the animal's water bowl beforehand or something like that. But the reality is they don't know they're going in for surgery. So I don't think they're going to be stressed. It's probably more when they're there in a strange environment. So basically my question is, are there remedies that you would recommend before surgery or do you mainly leave them for after surgery? And what are your top 3 post-surgery remedies?
Only after surgery.
Okay.
Yeah. Because as you said, the remedy removes the susceptibility. And, a really good example was my daughter, one of my oldest daughter, quite some time ago, probably it was hypericum before she went in for dental work. And when you go into the dentist, he injects an anesthetic in your mouth, right? In your gums or whatever. Well, he did it and it had no effect. And he had to inject about, I don't remember how she said, 4 or 5 doses before it finally took effect. So I said, don't give it before. The homeopathy is used to treat a disturbance of the life force, not a healthy one. So you treat the disturbance and the disturbance comes on after the surgery, right? It's like an injury. So that's what I did. I had treated that. Now, as far as the main remedies, of course, arnica is a big one. Hypericum, if it has to do with the mouth or if there's a person, it'd be the fingers and toes, the feet, hands, that's areas that it corresponds to particularly. Sometimes ledum, vellus perennis for internal organs, like surgery on the liver or intestines or something. You know that one, vellus perennis.
Yeah, I always say ballast for the boobs and the balls. So I was taught it.
Yeah, so those are good remedies. And I found going back to when I was in the SPCA and I started using remedies there, I would use arnica after surgery if there's any discomfort. But I didn't see that much at all. I would say one out of 100 or less would come back and say they had some discomfort and I'd give them arnica and that solved it. But most of them didn't have it. So I would wait and see if they're uncomfortable or not. If they are, then, arnica is a good one to start with, don't you think?
Always. Absolutely.
Yeah.
And for administering remedies, have you found any really clever tricks? I've actually got 2 donkeys, and you know how we get taught not to give remedies with food? Well, Micah, who's studying with you, she was actually the one that's told me to just give the remedies in the carrots because she's equine expert, and she said that works. And so what I did, I actually made a little hole with a knife at the top of the carrot. I put the pellets in it and I gave it to the donk, and he just ate it that way. But for administering remedies to animals, have you found any clever tips and tricks over the years?
So it doesn't work just to open their mouth and put it in, huh? It's too hard.
Not my donkey, no.
No.
He's a stubborn ass.
Well, if it is difficult to put pellets in the mouth, and sometimes like with dogs, you could just put them in the palm of your hand and they'll lick them right up, They won't take anything you give them. But like with cats, if that's not easy to do, I just have them dissolve it in a little bit of water and give it with, I could dispense a plastic syringe that they could use to squirt it in their mouth. Or you could come up with something like an eyedropper or something. So once the remedy's in liquid, then you could and then if it was too hard to do that, say it was a cat that was too aggressive, like I have in my clinic when I was there at the SPCA. We get cats in that were feral. You know what that means? Where they were wild,
Wild, yeah.
before they are not domesticated.
Mm.
And you couldn't touch them. And if you came up to them in a cage, they'd get in the back and open their mouth and hiss at you. So I just get a syringe with an 18-gauge needle and I'd squirt the remedy into their mouth from a distance. Another way you can do it is mix it in milk for cats or cream.
Mm.
And you can give remedies. I don't like to give remedies in food just because I'm too nuxy about it, but it does work. Have you ever studied Gallivarden's work?
No. What, can you say the name again?
Gallivarden. That's his last name. I don't remember the first name.
No.
Oh my gosh. Oh, it's amazing. Amazing. Gallivarden's work. He was French. I don't know when he lived, some decades ago. One of his books is A Cure of Alcoholism, treating severe long-term alcoholics. It's amazing. And then he did a repertory on the psychic symptoms for remedies.
So
well,
he's
anyway,
a homeopath.
Yes. His work is fascinating. But what's interesting about it was that he would, when say that, very often say was an alcoholic. Very often it was the wife or daughter that would come to him and say, would you help my father or would you help my husband, who didn't want to stop being alcoholic, right? So he would just ask them what the symptoms were and he'd give them the remedy for that treatment, which they would then put in the drink, in their alcoholic drink, or they'd put in the food, and that would work. So he did a lot of examples of putting remedies in food, and it worked just fine. So yeah, you might want to study him. It's fascinating.
Oh, I'm going to now. That sounds amazing.
Yeah, they're not big, thick books, but they're very interesting books. And one of them is, let me see if I can grab it here. One of them is, if you can see it.
The repertory of the psychic medicines with Materia Medica. Oh, wow. And it's published through B. Jane.
Yeah, this one was. I had for some years. I don't know if they still do it.
Psychism and Homeopathy. I have never heard his name. I'm so excited to delve into this. So John Pierre, it looks like his name is. Very French.
Yes, yeah, right. Jean Pierre.
Oui,
oui.
Oui, oui. Well, my name is French. It's actually Eugenie, but I just get called Eugenie in Australia.
Yeah, so you'll find it very interesting. The work he did was impressive.
Wow.
So I think that's what I do with animals. I put it in the food if necessary. If there's a choice, I try to give it to them by mouth and some way or the other. Usually you can get horses, you can put it in, but especially as a liquid, it's no problem. But often you can put pellets in, lift their lip up and put the pellets in. Dogs too, usually, unless they're difficult dogs for some reason. Cats are more touchy.
Yeah. We've got 2 dogs, 2 cats, 2 donkeys, and 4 chickens.
Oh, wow.
I've had lots of opportunities to administer different things to different animals.
Actually, you can treat birds by liquid and just drip it on their beaks, and it runs down into their mouth. You could also put it in their drinking water if you treat a number of them.
That's beautiful. And actually, Pat Ahern, who I had on the podcast, he's a farmer in Ireland who uses homeopathy, and he just sprays it on the cow's vulva to help them to dilate if they're about to give birth.
Wow.
The things you learn on this podcast, Richard, I'll tell you. Well, now is a little bit more of a somber question that I have here. Is about animal euthanasia, because it's something that I just have this thing. So please, nobody attack me. I have lots of thoughts in my head all the time. They say you're allowed to talk to yourself as long as you don't answer back. I'm not answering back yet. I just do lots of talking to myself and lots of thinking. And one of the things I think about is that I think death has been medicalized quite a lot for humans and for animals over the years, whereas I actually think it should be something that is as natural as birth. And I wonder if there's some sort of spiritual awakening or something that we go through when we go through the process of death. And I wonder that for some animals, we go and euthanize them. And I understand it's annoying having to look after a cat that's peeing everywhere in your house every 5 minutes. So sometimes it's just convenient and all those things. But I sometimes wonder about euthanasia. What are your thoughts on that? And is there anything that we can do with homeopathy to maybe use that instead of the drugs, or maybe then to even help the drugs along?
Homeopathy works very well for euthanasia. However, only if the animal's dying already. In other words, the similar remedy matches the dying state. There is no remedy that you can give them that will make them die. And the chief remedy is arsenicum 10M. It works in almost all 99% of the cases. You can give one dose of arsenicum 10M, and they usually die a few hours later peacefully, if they're dying. And usually the way, at least in dogs and cats, usually the way you know that is that they, of course, are sick in such some way that they look like they're not doing well and they're weak. But the clue is when their temperature starts to drop, their body temperature. So if it goes down a degree or two, that's the sign they're going to die soon. So that's a good time to get the remedy. And if they're not dying, it won't hurt anything usually. I've had cases where I had them give arsenicum 10M and they actually got better for a few days. But then they went on to die eventually, but it's like...
And that's the thing with the vital force of homeopathy. People, I'll get a private message now and again saying, can I use homeopathy to abort a child? And I'm like, no, homeopathy works with your body, not against it. So it's not going to do that. But like you're saying, if it's ready, and often with arsenicum types, they'll kind of like hold on, clench to it. They're not ready to let go. So you give them that remedy and then they get, it gives them that emotional release to allow them to let go. And
Right.
And then, Richard, I want to hear all about your school and what sort of people can enroll and how long is the course? Because I know Micah that's studying with you, she's actually a vet and also a lawyer. She's a crazy smart lady, and I'm really excited that she's finally studying homeopathy as well, because she's pretty much an honorary homeopath. She prescribes for animals, all the time anyway. So it's so great that she's doing your course, and I can't wait. I'm so glad she's local. She's going to be booked out before she's even qualified. But tell us about your course and who can enroll? Is it anywhere in the world, only certain countries? What sort of people can enroll? How is the content offered? Just everything you can tell us.
Well, it was started as a course for veterinarians, of course, because that's what I am. And I'm not training people to do human treatment, though we could. We have the knowledge. But anyway, the course is meant to be training veterinarians, and that's what we primarily want. We have made some exceptions. We have treated sometimes we have veterinary technicians sometimes. I'll explain a little bit more in a moment. Veterinary technicians, sometimes nurses, not so much MDs. I don't think we've had any MDs go through our course. Sometimes people that have rescue facilities for animals, where they will be treating the animals they have there that they've rescued, whether it be horses or dogs or whatever it is. The problem we have, possible problem, is that if we train non-veterinarians and then they go out and start a practice, we are in trouble with the state boards. We're training non-vets. So we have to be very careful. And we, as I say, almost all of them are veterinarians. We have a few exceptions. The exceptions have to promise us they won't start their own practice. They can work with a veterinarian. They can treat their own animals in a rescue facility, whatever would be acceptable versus having a practice as if they were a veterinarian. So that's the issue we have to be careful of, because the state boards are tricky here. So far they haven't been too much of a problem because we've been careful. But if we get into, as I said, we could get into real difficulty. So yes, there's some people that could take it. They just have to apply and say what they want it for. And as I said, within one of those categories, they would probably be accepted, some. But we do want primarily veterinarians. That's the plan.
And the anyone in the world? So like worldwide? And is it all on?
Yeah, right. This year it is. As I said, it started in 92. And it went every year until I think it might have been 2013, because I was getting older. I handed it over to a woman that trained with me, who's now the director. Her name is Sarah Steig. She's in England, and she's running the program. I'm on the faculty, but she's running the program. So when the COVID thing happened, then for the first time we had to skip a year because people couldn't travel. Our training was always in person, which is really fun. And it was about a year long with homework and casework and all that stuff. So Sarah started the program about, several months ago for the very first time online. So we're doing the entire program. It's about a year and a half long. And we're doing it, which includes people from Australia and India and Switzerland, I think, Sweden. It's like quite a few from the U.S., but a lot from other countries too. So yes, that's a nice feature of doing it online.
It really
So
is. I mean, and COVID has kind of forced a lot of us who've been a little bit not so savvy with the technology. Everyone's kind of been forced to adapt, and it's actually turned into quite a beautiful thing. I mean, there is
yeah,
a lot that we can do online. And look at the two of us
yeah,
here chatting in like completely different time zones on opposite ends of the world, sharing your
yes.
beautiful message with the world.
That's true. Technology has that advantage. Yeah.
It does.
It's nice to be in person, though. You have more
It
relationship with
is.
people.
It is.
Yeah.
I went to the Australian Homeopathic Conference in November last year, and just seeing all those people in person, and so many that I'd interviewed on the podcast that were there in person, it was just, it's beautiful. And then when you do then meet each other online afterwards, that relationship is just better because you have like a nice foundation to work off.
Yes. Yes, it's true.
Richard, I could just keep you all day and ask you bajillions more questions, but I wanted just a final message, perhaps. Well, there's a couple, because I want to ask you, where's the best place to buy your book? Do you prefer Amazon or do you prefer directly through a website?
No, not my website. I might have a link there to Amazon. I don't remember anymore. No, just a bookstore or Amazon, whatever.
Okay, excellent. And then there's your website, which is drpitcairn.com, but then you've also got the school's website.
Yes,
Have you heard of it?
pivh.org.
pivh.org.
PIVH stands for, when it was taken over by Sarah, as I said, back in 2013, I had been calling it the Professional Course in Veterinary Homeopathy. She wanted to rename it to the Pitcairn Institute of Veterinary Homeopathy, which I found embarrassing, but I had to go along with it.
I'm glad you listened to her, because I do think it's very fitting and it's beautiful.
So that's why it's PIVH.
pivh.org. Excellent. And then just a final message that you want to give to, maybe there's some pet owners out there listening to this at the moment who maybe haven't really thought about using natural medicine for their animals, because we often, when we start awakening to natural medicine, we first start doing it on our families. And then suddenly, people go, oh, actually, maybe I don't have to go for my dog's annual vaccine, or maybe I don't have to do this or that with them, or give them those steroids. Maybe there's another alternative. So do you have a message for those listeners out there who may be sitting on the fence about giving homeopathy a try?
Well, I think that they would just have to, if they have an issue with their animal, all they can do really is just consult a homeopathic veterinarian and see if the treatment could be done. That's the only way they're going to see. You can't convince them otherwise. But I found in my practice, and most practitioners do find, that if you're presented with an animal with a chronic condition and you're able to solve it, you've got a loyal client the rest of your practice time. So I would encourage people to consider it, especially if they have a health issue that's not being resolved. And again, to emphasize what we've talked about earlier, the understanding from the homeopathic perspective, speaking now, it's not the conventional one, that disease is not cured by making symptoms disappear with drugs or surgery. Disease is cured when the influence of the disease is removed on a non-physical level. That's what we've learned. Because what will happen if what is affected in the person or animal when there is disease occurs? Because Hahnemann tells us what he calls the life force, which is the energetic configuration that takes care of us and drives us and makes our bodies. He tells us that when that is affected by the disease influence in such a way that it what he calls mistunes, takes a different configuration, that's where symptoms come from. It's a defensive posture. The life force is doing its best to try to solve the problem. Maybe not very well. In fact, Hahnemann tells us it doesn't do a very good job because it was never made to deal with disease, he tells us. So the life force is distorted, and it's a living, that's what we are. We're not our bodies. Our bodies are not living things. It's the life force that's living. It's living us. Okay? So when the symptoms on a physical level are blocked, the life force adapts to that. It wants to, it thinks its job, put it into words, it thinks its job is to resist the disease influence. That may not be necessary. It may be something that we would consider insignificant. But that's a whole different topic going to susceptibility. But let's assume that it thinks it has to defend itself against this influence, okay? Whether it be a virus or be poison ivy or whatever it is. A food. It thinks it has to defend itself. That's why it's doing what it's doing. When it thinks it has to defend itself, that's its job, and it's a living thing, and you block it from expressing its defense, it adapts itself and comes up with a new defense.
Yes.
So you can have a case like maybe there's a skin eruption and you're able to stop the skin eruption with drugs. Well, now the life force is, okay, I'll do a different way, and comes up with a liver problem or diarrhea or something. And then you can block that. Okay, well, if that's the way you're going to be, I'll just take off on my own and form a cancer tumor. So you're dealing with a living thing. That's what has to be. I know a lot of people won't accept that, but I'm telling you, this is really basic. It's not some kind of a machine. You're dealing with a living entity that can adapt itself.
Mm.
And that's what you have to understand. And so the life force will adapt itself with treatment. And what's different about homeopathy is you are actually able to remove the disease influence, so the life force no longer thinks it has to defend itself.
Mm. That's a
Isn't that
beautiful
interesting?
description. Beautiful description. It's like that vital force has its own innate higher intelligence.
Right.
That it's trying to work in your best interest, but if you keep stopping it from doing that, it's going to have to continue finding ways to do that. So then if you use homeopathy to remove that perceived threat, well, a real threat, then it doesn't have to do that anymore. It can just focus on being your best self on all mental, emotional, physical, spiritual level, right? Like
Right,
it can
exactly.
then,
That's
instead
what
of
Hahnemann,
spending all that energy on fighting the disease, your vital force can spend the energy on really
just
bringing you to
maintaining
your
a
highest good.
healthy, strong, that's our birthright. That's our natural state, is to be healthy and strong.
Mm. And
That's
using
what the life
that
force
energy,
does.
using that vital, strong energy for creative pursuits and, loving the people around us. And, that can definitely turn into a whole other conversation as well.
Good.
Oh, Richard, thank you so much for your time. This has been such a soul-filling, beautiful conversation. And I can't wait to share this with our audience. Thank you so, so much.
Oh, good. Thank you. I'm glad you enjoyed it, and I enjoyed meeting you.
Hey, all the best. Bye.
All right.